video, we're going to do another concept map branching off of antihypertensive. Definitely go watch the first video on how these different drug classes work as far as antihypertensives. Yeah, go watch that video. It's all part of a series. So, once again, I'm just using some scrap paper that I have. My table, it's not dirty, it's just got scratches. It's just a little cheap table, yeah, okay. So, for this, like I said, I'm just using scratch paper. And what I'm gonna do is we're gonna make a, kind of like a concept map and a chart all in one. Now, this, you can do it, you can just do this concept map to understand all the actions, or you can just do one of these concept maps for each drug class, and you all will understand as we go through the video. Okay, so for this map, we're gonna do beta blockers. So you can use a ruler, you can do whatever you want. I'm gonna go ahead and use a ruler real quick, y'all. I'm gonna write right here all the actions for beta blockers. Go watch the video if you wanna know what they are. So under the antihypertensive settings, once again, this is the book that I'm using. Comment down below what book you're using in nursing school. Depending on how many people use the same book, I might go ahead and grab that book to do future videos for you all. Okay, so I'm looking at this chart at the end of the chapter, and this is a great chart. You could take this chart and then make your own chart based off of it. You can also do flashcards based off of this. And I know you're like, okay, why would I take all this information and write it right back out the same way? Look, when you're learning something, it's so good to put it in your own handwriting, for you to write it out, for you to put it on paper. That way you can just look at that paper versus taking this whole book with you around everywhere to church. I mean, to church. You take to church too, to clinicals and to work and stuff like that, because your job is going to be looking at you crazy walk through with this book. But if you just have, you know, just like this, just out like, oh, okay, I'm just going over some drugs. Like, it's way less like, what the heck are you doing? You know what I'm saying? Especially just commuting and just having space for everything. It's way better to put things in your own writing. You remember it better when it's in your own writing. It's just, you will get it better, okay? All right, so these are the drugs that are all beta blockers right here, and then we have a few more on this side. Now I'm only going to write out the ones that I've seen. You can write out every last one of them. Maybe your teacher will tell you specific ones that they want you to remember, but I'm only going to write out the ones that like I've seen like normally. But basically what you need to know, anything that ends in OL is a beta blocker. It's like, oh, laugh out loud. Beta, you thought you was coming through. Psh, we're gonna block you. I don't know, yeah. You find a way to remember this stuff, okay? So we're gonna first start off with atenolol. Can you all see it? So I'm gonna start off right now, atenolol, which is definitely a drug that I have seen on the field a lot. As you can see, anything that is bold is like a common use. Okay, like what it's used for the most. I'm going to write out all these uses here on our concept map. Just common uses are hypertension, which is what we're basically learning about. Cardiac arrhythmias, which if you look at the way that the beta blockers work, it says that that the beta blockers give an anti-arrhythmic effect. Partially, I believe that is due to it decreasing the excitability of the heart. So that's kind of, once you know the action, once again, once you understand the action, it'll help you to understand the usage, okay? Another one is migraine headaches. That's what the HA is. Heart failure, angina pectoris, and glaucoma in the form of drops. Once again, it decreases the heart rate. So it's gonna, this is more like a localized effect of the beta blockers, okay? I underlined, well, that's the uses. I underlined the ones that were bold in the book. That way I know like that's like a big common usage for these drugs. And that it's not just hypertension, even though we're focusing on antihypertensives in this video. So if you want, we can make this into a little box. You can format this however you want. You can make it more neat. You can make it more organized. You can make it all over the place, whatever you want to do. All right, so I'm going to mimic that chart that we just looked at. Now you can write it out like a full-on chart, which is what I'm going to do. You could just write out that specific drug and write out everything about that drug. But I'm going to do it as a chart so I don't have to keep writing actions, uses, da 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 da. I could just have it all across here and then you'll see. Okay, so I don't know if this is that, oh, yeah, look at that. I'm just getting through it. I don't know if this is at all straight or what, but we about to just get into it, okay, boo? Put the name of it, the use, the adverse reactions, and then those, if anybody needs to know, adverse reactions is just side effects. All right, so we're going to start off with atenolol. Remember, we got the OLOL for beta blockers. The use. Now, I am looking at, I'm going to go back to our chart in the book. If you look at the uses for most of these, hypertension is across the board like one of the uses, right? So we know that we're doing antihypertensives, duh. Now I want to look at the adverse reactions. This is the adverse reactions column. You're going to see a lot of the same type of adverse reactions because this is the same drug group. So I don't want to write the same stuff over again. So I'm going to look at the stuff that seems to be common, like bradycardia is a common adverse reaction across the board for all of these. Dizziness is a common reaction, and hypotension. Now let's just think about it. Bradycardia is a common adverse reaction because what does beta blockers do? They work on your heart rate. Bradycardia is just low heart rate. So if this drug, the way that it works in your body is that it lowers your heart rate, an adverse reaction is going to lower it too much, okay? Dizziness, anything that has to do with your blood, like lowering your blood pressure, anything like as far as decreasing like the workload on your heart, is going to cause you some dizziness because it might get to the point where you're not getting enough blood and oxygen throughout your body, like your heart is a little too relaxed, okay? That's why dizziness is on here. And then of course hypotension, because we're treating hypertension, and one of the adverse reactions is that it just might get too low depending on your dosage, your activities, what you ate that day, what other medications you're taking. That is going to be a common adverse reaction. And then also, yeah, nausea, vomiting, diarrhea. Every freaking medication pretty much is going to cause that issue because a lot of times it works on your GI system. You have to swallow it, and it works in your GI system. So of course it's going to affect your GI system. So we know that to be the case with every drug. So I don't always write nausea, vomiting, diarrhea, nausea for each drug. I'm not doing all that. I'm not going to do hypertension. I'm not going to do that for each drug. Instead, I'm going to put over here common adverse reactions. Boom, we wrote every freaking thing we needed to write instead of writing it over for each and everything, wasting time that we do not have while we're in nursing school. Okay, so one of the common uses is hypertension. Acute MI which is basically a heart attack as it's happening, not to prevent it. This is actually to treat it right there as it's happening. Based off the chart, the only thing that I see that's different from what we have right here is nervousness and weakness, which it makes sense. If your heart rate is low and you're getting dizzy and all that, it's going to cause you to have weakness. Or if you're not having enough blood circulating, enough oxygen, you're going to be weak, things like that. All right, now the dosage, 50 to 200 milligrams a day. Some people, they don't, like, at least when I was in nursing school, I was like, dosage, I don't even know a dang on dosage. But you all, when you start working in the field, this is so important because you're going to be taking orders from MDs, you're going to be looking at orders. Doctors put in orders and the computer's wrong, they write them wrong, you might hear it wrong. So if you get an order that you're like, okay, a Atenolol 500 milligrams a day, you're gonna be like, wait, I know that the normal dosage is somewhere between 50 and 200. Let me clarify this order, okay? More than likely, maybe the doctor wanted 50 milligrams, okay? So yeah, you want to know this. This is very important, especially with patient education and also just like taking off orders for MDs. You want to know your dosage, okay? All right, so that's that. I'm going to go through the rest of this chart, going over meds that I don't, look at this line not straight at all. Yeah, I'm being a little anal today, but I'm really not because I don't care. But I'm going to go through and, like I said, write down the meds that I know. We're going to go through all those real quick. Okay, so I went ahead and finished off the chart. Again, there's about 2, 4, 6, 8. There's 10 drugs on there. I only wrote out 4 that I've seen that are common. Just where I work, of course, working in different settings, they're going to be more common than others. Definitely this one, metoprolol, is common everywhere. I think this is like one of those like basic, probably cheapest beta blockers that are out there with like the least amount of side effects for your patients. I think this is probably the one because I see it all the time. So right here, I also put any other names that these drugs are associated by, because say for instance you got a patient coming from the hospital to your facility and you have to take they give you like a discharge paperwork and you take those drugs on there. You have to verify those with the doctor. So you call the doctor and say patient is on low pressure, 100 milligrams daily, if you only know it as metoprolol, when you see low pressure, you're gonna be like, what the heck is that? And then you're gonna take time to look it up, blah, blah, blah. But if you know both of them, guess what? You know both of them. Sometimes in that test, the teacher might only have low pressure, or in NCLEX, you might just see that. You might know everything there is to know about metoprolol, but if you do not know the other name associated with it, girl, you don't know nothing. Okay, so that's why I have both of those names on there. And it just depends on like your area you're in. There's another name too that they use in Canada. Anyways, it just depends on what the area that you're in and the drug, the pharmacy, all that good stuff. So as far as the uses, I just put this, which is like ditto to this. It's like all the uses here plus heart failure. And then one of the adverse reactions is heart failure. And I put our doses. Now over here you see ER, that means extended release, meaning that these release throughout your body like slower. Usually with extended releases, you are not supposed to crush those, just something that you should know. So this just gives a dosage for those. You see how there is less given. So 50 milligrams a day for the ER, and then 100 to 450 for just the regular metoprolol. You get less with the ER because it's gonna release slower in your body, okay? So you don't need to use as much. It like extends its release time in your body, or the half-life, I should say, if that makes any sense. All right, propranolol, also known as Indorel. Yeah, know it'd be hard for me to breathe. Whew. With these, there's a lot of different uses, some stuff that I've never seen before. This hypertrophic aortic stenosis and phenochromocystoma. I've learned about these, but honey, I don't remember all that. Okay, but anyways, I thought this was interesting that one of the adverse reactions is hyperglycemia. So that's really interesting. So your doctor might not want to prescribe this to their patients that have high blood pressure to begin with, because this drug can cause them to have even more high blood sugar. So definitely don't want to give this to a patient like that. Also, a lot of the side effects for this has to do with your lungs. So bronchospasms, talking about the bronchi in your lungs, and then pulmonary edema. You probably don't want to prescribe this to a patient who has a history of this or who has some type of respiratory issues. A lot of times doctors will call you, you'll tell them something's going on, or you'll call them, tell them something's going on with their patient, and they might start a new medication. Say your doctor starts this medication, and they're like, hey, does she have any respiratory issues? And you go over their respiratory issues. Like, he's like, okay, he or she is like, okay, let's go ahead and just do metoprolol instead, Now, yes, doctors are gonna ask you what was I gonna say? What drugs their patients are taking. They're gonna ask you what diagnosis they have. They're gonna ask you all those questions. These doctors usually have hundreds and hundreds of patients. They don't know all the freaking diagnoses and drugs for all their patients right off the top of their head. So they're depending on you to know that when you call them with an issue or anything like that, like maybe you all look at somebody's blood pressure over the course of a week, and you call the doctor and you say, hey, her blood pressure's been running high, and the doctor wants to start a new med. At that point, you want to know what drugs are already on, so that the doctor knows what to prescribe based off what type of adverse reactions can be caused for that patient. So if you have a patient who, like I said, who has respiratory issues, they might not want to prescribe this medication. This might be the best medication for one of these issues that they have, but they might want to go with something else, because that having high blood pressure is not as bad as your patient getting a pulmonary edema. You get what I'm saying? So definitely understand your patient, have that patient's chart out on the computer or whatever. Go over those drugs before you call the doctor, because they're gonna ask you and you need to know, and they don't have time to be waiting on that phone for you. Okay, now let's look at the dosages over here, just so you can get an idea. This one says 120 to 240 milligrams a day divided. So what that might mean is that, say for instance, that might mean that the patient might get 120 milligrams BID, or they might get 60 milligrams BID. Divided just means like they don't typically get 120 milligrams once and that's it. It might be twice a day, 3 times a day, whatever the case may be. And then down here, I don't see this that often, the Timolol, but I do see it. I do remember learning about it in nursing school too. But once again, here, one of the side effects is pulmonary edema. So once you understand the side effects, you can kind of be like, oh man, this person did just get put on this drug and her sugar just keeps jumping up. Contact the doctor and be like, hey, such and such got on this drug maybe a week ago. I'm noticing her sugars are going up. Do you want to decrease the dosage? Do you want to change it? Whatever the case may be. You know, this is very interesting. I did not know that can cause that. So this just shows you, even though these drugs are acting the same way on the body, the drug itself can have different effects on the body. So it's really interesting to understand that. And so, as you can see, we have our actions, our usage, we have our little chart of everything that we need to know about each drug. And then down here, just to make things easier, we have some of the common adverse reactions. I also want to add down here an area for patient teaching. When you teach your patients, some settings, it's not about teaching the patients. Like in nursing homes, we're not doing a bunch of patient teaching. This is for us to know. We need to know, especially when, say, you write this order out for your patient to get metoprolol 100 milligrams a day. You need to put in there, hey, nurses, check heart rate. If below 60, do not administer. That's pretty much typically across the board the standard for this medication. That is like a given when the doctor gives you this order. Of course, you need to check the heart rate prior to giving any of these drugs, okay? Because once again, this drug works by decreasing the heart rate. So if your patient is at a 60, why would you want to give them something that's going to decrease their heart rate? Next thing you know, their heart rate is at a 55, going to 40. So you're like, why is my patient dizzy? Why is she falling? Why is she having headaches? What is going on? What's going on with my patient? Honey, you didn't check their blood. You didn't check their heart rate before giving it to them. And now you're dropping them lower and lower, okay? So patient teaching is to check heart rate first. If it is less than 60, do not administer. That's teaching for you as well as your patient. Okay, you need to understand this. You need to know this. This is very important. You might get a question on NCLEX that says you are to give your patient 100 milligrams of metoprolol. You check your patient's heart rate prior to administering. The patient's heart rate is 56. What do you do next? The question might be, call the doctor. Hold the medication and call the doctor. Hold the medication or administer the medication. Those all sound like, okay, what the heck? So we know it's not administer that medication. Okay, if we know this, then we can start to decide, okay, which one of those is better. So, okay, I'm gonna just bring it down to, okay, I'm not gonna give it to her. And what was all the choices I said? Hold the medication, hold the medication and call the doctor. Just call the doctor and get the medication. So we're not gonna give the medication. We're not gonna just call the doctor. We're not gonna just hold it. We're gonna probably more likely hold it and call the MD. That's what NCLEX wants you to do more than likely. But you don't always have to call the doctor because their heart rate is low. But if you start to see a trend, you check their blood pressure is low again off of that, and you're seeing that they're having any type of adverse reactions in real life, you want to go ahead and call the doctor. In NCLEX world, they probably want you to go ahead and call the doctor anyways, no matter what, because the heart rate is less than 60. So once you know just this little tidbit about this drug, those little nuggets of information, they're like golden. You need to get that so that when you have those little questions in NCLEX, like, you can just knock that out. Yeah, you can pass it. Okay, so this is our chart that we made for beta blockers. Once again, if you want to see this chart, go watch this video. It's like the actions of antihypertensives, how they act in your body. We put it down to 5 different classes. And you could do the same thing. Like I said, instead of doing this chart for all of them, you could just do this for each one. So you have one for beta blockers. You have one for calcium channel blockers, the action, the uses, the common adverse reactions, and then you do a chart. Do the same thing for all of these. You can do them for every last one. I just want to do it separate so that I can understand the action, because for me, action is so important when it comes to pharmacology. But then secondly, you need to know the drug names. But even if you didn't know all these drugs, guess what? We know that they all end in OLAW. Remember? Beta thinking it's gonna come through and it's being blocked. Like, oh, laugh out loud. You've been blocked, beta. Okay? That's how we remember. So even if we don't know any of these drugs, we understand how it works, the usage, the common effects, and some patient teaching about it. Even if we don't remember the names of them completely, we know that when we see that and we know this information, we're gonna be good. Okay, so that's my second video for you all, going over antihypertensives. Like I said, in this video we just focus on beta blockers. Let me know if you like this type of content. Make sure you like it. Yeah, give me another type. Anyways, make sure that you like the video, you share it. Let me know if you have any suggestions or anything I can do to maybe change up the videos to make it easier for you all to understand. Like I said, thanks for watching. Go follow us on the YourFavNurseB Facebook group, my Instagram. Just follow me, give me some love, y'all. Try my best to get all these out. I'm doing my best, not trying. We don't try, we do. So I'm doing my best to get these out to you all. Whew. Out of breath and all, pregnant and all, baby running around doing what you want to do, hands all swollen and all. I'm doing my best to do this for you all. So thank you all so much for watching. Peace.